Your mommy intuition is kicking in already and you're thinking, I have no idea what a round ligament is, but I think I have round ligament pain. Hey friends, Nicole here, and you just might have round ligament pain. We are going to talk about how you know if you have round ligament pain and a few things that you can do if you figure out, yep, this is round ligament pain, to hopefully make you feel better, because a lot of times this is something ongoing throughout pregnancy, and the bigger our belly gets, the more intense the pain gets. So we want to make sure you have some good tricks up your sleeve to take care of that right away. First things first, is this even round ligament pain? I want you to ask yourself, does this feel like lightning shooting through my crotch, or do I notice this when I spread my legs to get in the car or to do a lunge? If that's when you're noticing this pain and it's kind of right here at your pubic symphysis bone, it's probably not round ligament pain. That's pubic symphysis diastasis, or PSD, or basically a separation of your two pubic bones that are supposed to meet in the front, but as our pelvis expands because of baby, there's a stretching there, and that area right there can cause us some pain. So described as lightning crotch, sharp shooting pains right down our crotch areas, and we notice it when our legs are apart, that's probably not round ligament pain. Also, is your pain coming and going in waves that last a couple minutes? Is it a tightening feeling of your abdomen? Is it like a backache? If so, again, this is probably not round ligament pain. That could be contractions. If you are still early, not in your third trimester, nowhere near the end of your birth, this is a great time to contact your provider, because we don't really want contractions that intense this early, or maybe they're just Braxton, whoo, that's a tough word, Braxton Hicks, and if that's the case, then no worries. Braxton Hicks are usually not a problem at all, we'll just carry on, but you would want to check with your provider to make sure. But if you are experiencing a sharp pain right in this area, right in here, then you might have round ligament pain. If that pain comes, it's quick, lasts a few seconds, and then it's gone. If you notice it when you stand up quick, or you notice it when you roll over in bed, those quick transition movements, or maybe when you go to laugh or sneeze, those quick jostling movements, you notice that pain right kind of in here. I'm going to go over the anatomy in a second, but it's kind of right in this area. Those are good indications that you have round ligament pain. I've been pregnant twice in the past. I am not currently pregnant, so I'm going to use my trusty ball belly to kind of demonstrate what might be going on here. Our round ligament runs from our pubic bone right in the middle below our belly buttons, but lower. It's that bony thing that you feel just above your vulva there, vagina. And you can also then track it kind of on a diagonal to the outer portion of your belly. So when we're not pregnant, there's a lot of slack. It's not pulled as hard, so it's not uncomfortable when we're not pregnant. When that band gets stretched, it's uncomfortable, as you can imagine. And so this is when we notice round ligament pain. When our belly is growing, again, it's getting further and further away, that's a cause for the round ligament to get irritated. When you go to stand up quickly, basically that round ligament is in a shortened position when you're sitting, and you go to stand up and it gets pulled tight really quick. And when that happens, ooh, that's when we notice that sharp shooting pain. So some things that we can do are try to stretch out our ligaments and get them used to that feeling, and kind of desensitize the nerves around this ligament so that it doesn't cause those quick sharp pains all of a sudden when you go to stand up or sneeze. Here are a few stretches that you could do. This first stretch is like a cat-cow movement. You're basically arching your back up and then extending your back. With this activity, as you can see, there is a lot of movement going on at my pelvis. So I am shortening that ligament and lengthening that ligament. I'm breathing, I'm moving slow. When we stretch something slow, it's not as big of a deal. It's not going to hurt as much as when we stretch it fast because we go to stand up quick. So if we can get that ligament nice and stretched out and get it desensitized going slowly, hopefully it'll feel better when you have to get up and run to the bathroom quick, because we all know pregnant people are doing that a lot. The second stretch that you could do is more of a hip flexor stretch, but because this ligament kind of runs along the same place where your hip flexor does, this stretch will work really well for you. If you are in your second or third trimester, you're going to want to be really careful about how long you stay in a laying flat position, or use extra pillows to prop yourself up just a little bit. You want to also be careful how you get in and out of this position. Go ahead and roll to your side and then to your back so you're not straining your belly muscles getting in and out of this position. The main idea here is that you're laying on your back and preferably on the edge of your bed so that your feet and basically your knee down is dangling off the bed. The higher your bed, the more your thigh is no longer horizontal. It's down a little bit towards your knee, so it's a little bit angled, and this can even put a little more stretch on your hip flexor. You can also play around with bending and straightening your knee, and you'll notice that you feel it in different places. The main thing is that you are able to feel a stretch in your hip flexors, and likely that is going to stretch that round ligament for you, which is what the goal is here. You can hold stretches for a minute, 2 minutes. Like I said, you're just being very careful if you're in your second, third trimester that you're not starting to feel faint from laying on your back. This would be a sign that you should change positions because your body does not like you laying flat like this. The third stretch that you can do is an upright hip flexor stretch, and also going to be stretching and relaxing your round ligament. And you can do this on a half kneeling position, as you can see from this little clip here. And when you do this, you could definitely put a mat under your knees, which I did not do, and I was kind of regretting that I didn't take the time to do that. It hurts your knees a little bit, but you're just going to rock in and out of this position, or you could hold it while you're feeling stretch in your hip flexor muscle. You can also raise an arm up and even lean to the side to really play around with where you're feeling that stretch. You want to be feeling the stretch in your hip flexors and also where you're experiencing that sharp round ligament pain. Hopefully those 3 stretches will help you out a ton, but there's something else we need to be aware of, and that is those quick jolting movements that are unexpected, that our body doesn't have time to warm up and get ready for. So when we laugh or sneeze, the trick is to lean forward just a little bit. Let me get my belly back out here. If you have that ligament on stretch here, say you're standing and you go to sneeze, if you just lean forward, you can see how that ligament just goes on slack a little bit. And when it does, it's not going to hurt so much when we go achoo, because it's already down here, so achoo. So that's a good trick for when you're going to laugh or sneeze. Something else that you can do are try to avoid those quick movements. So if you know that you've been sitting for a little while, you need to get up and get to the bathroom quickly, take your time with that transition from sitting to standing, and hopefully that's going to be a little bit easier on that ligament so it has time to slowly stretch out instead of get wham, bam, thank you, ma'am. The last bonus tip that I'm going to give you, I didn't find this anywhere else online, so if you like this tip, be sure to hit that like button because I think it's pretty fantastic. It worked really well for me, and that was just massaging across my round ligament. So if I have my round ligament here, I'm just going to take 2 fingers and I'm going to rub across the ligament. Obviously this band is a lot thicker than what my actual round ligament is. And some of you may not even actually be able to feel your round ligament because it's not very big, it's not very prominent. But for some of us we can, and when we feel that, we're just going to run our fingers across it and massage it. And it just helps with the getting blood flow to that area, helps manually stretch it out just a little bit, and hopefully brings you a lot of relief. There's no risk of doing any damage as long as you're not really pushing, and you shouldn't be because you're just going across that ligament. But you're not going to hurt baby, you're not going to hurt you, so give it a try. If that can bring you some relief, I am all about doing things like that. Those are my tips for round ligament pain. I would love to hear in the comments if you did something that I didn't mention in this video that really worked well for you. If you are pregnant and getting ready for labor and delivery, you really need to check out this video up here about the best positions to deliver your baby in, because postpartum recovery can be really hard, but especially if our labor is tough and doesn't go as planned. So check out this video and make sure you know all the best labor and delivery positions.